In the previous few lectures, we were discussing about some fundamental aspects of microfluidics, of course, keeping the biological applications in view. However, we have not specifically discussed how microfluidics can impact the healthcare scenario, and in the remaining two lectures we will be focusing on some aspects of microfluidics for healthcare. So, I would like to let you know that microfluidics for healthcare is very much specific or centric to the location at which the healthcare is delivered. So, microfluidics for healthcare should not be treated in the same way as, for example, it is done in an advanced country as compared to what is done in a resource limited setting. So, one has to be careful, and it has to be an integrated teamwork that delivers the healthcare at the location using microfluidics as a tool. Before getting into the details of how this is possible, let me talk about a specific example. Let us say that there is a patient who is suffering from fever in a rural place. Now, normally when the patient is suffering from fever, it I mean one waits for maybe 1 or 2 days or 3 days, because in most instances the fever will go away by itself within just a couple of days or maybe 3 days like that. However, there are instances when that is not the case, and then further intervention is necessary. So, when we say further intervention, we of course mean some basic diagnostic tests. So, these diagnostic tests may involve blood as a body fluid. So, when we take this into account, we have to keep in mind that the person who is there in a rural setting and maybe at extreme remote location, the person has to travel a long distance to go to a primary healthcare center where the blood sample is taken. And remember that this distance on an absolute scale may not be too large, but in a condition when the patient's health is not so good, the road conditions are not so good, and the transport available is not so modern, it becomes very, very challenging to take the patient to that location. Forget about cost and time, even the hazard issues that play a big role. Then in the primary healthcare center, some blood sample is drawn, and it is normally like it depends on how many tests are done, but normally at least one syringe full of blood, and depending on the age of the patient, that can itself give rise to an agony. For example, it may get very challenging to get to take this blood sample from a very young child because of obvious reasons, and then this blood sample has to be transported from this primary healthcare center to another pathological lab, which depending on the need or the level of sophistication demanded, it may still be located at a far away distance, and then this test will be executed. So, after these tests are executed, these results come out, and sometimes it takes 1 or 2 days for these test results to come out, and then actually by the time the result is available with the doctor treating the patient's condition may worsen. So, it is not a question of just the money that the patient can afford for the test, but also the time and other hazards. So, instead of this kind of a paradigm, can we think of a situation where instead of bringing the patient to a hospital, we make a small handheld hospital which is a mobile device and bring it to the patient, make a finger prick and take one drop of blood. Blood I am talking about as an example, but it could be urine, saliva or any type of body fluid, and then using these we perform a diagnostic test on the handheld device itself, and very rapidly we can get a readout which we can then use for subsequent treatment of the patient. So, it not only saves time, not only saves hazards, but also brings down the cost considerably. So, if implemented in a appropriate manner with appropriate controls and appropriate studies, validation studies prior to the implementation, then such a diagnostic procedure may actually revolutionize the way in which diagnostics is done in the rural scenario. So, not just diagnostics, there could be many other applications where microfluidics could be used in this way, and to emphasize the need of a teamwork, it is not just the question of microfluidics as a science or microfluidics as a technology, it is a teamwork between social workers, medical practitioners, entrepreneurs, engineers, scientists all together to come up with solution of such challenging problems. So, let me discuss then some of the challenges in rural healthcare. These challenges are important, and I would say that some of these challenges are possible to be overcome by microfluidics based technology. So, first is affordability, second is accessibility, third is even lack of awareness, which is itself a big thing in resource limited settings, and quality of healthcare services. So, these are challenges mainly related to the rural scenario, and eventually all these aspects result in an increase in cost. There are also organization challenges, like there is scarcity of skilled manpower who can do pathological work or sophisticated pathological work. Distribution and reach to the people who need medical attention is quite poor. Creating awareness is a challenge, and changing the mindset of people is a challenge. So, these people, if they are essentially depending on the clinical lab reports, and then there are certain associated implications like manual operation of instruments, delay of delivery, requirement of bulky instruments, all these essentially increase the cost. So, one should go for a solution which is rapid and at the same time cost effective, and that essentially is the paradigm of point of care diagnostics. So, when we talk about point of care diagnostics, we should have also a broad perspective. So, what is point of care diagnostics? It is essentially that instead of bringing the patient to a diagnostic center or a hospital, you make a handheld device which you bring to the patient, and wherever the patient is there, maybe at the hospital bed, maybe at home or wherever, you bring that device and use that device for the diagnostic purpose. So, it may use a body fluid or it may not use a body fluid, it may use some other body signals maybe. So, but it should be at the site of the patient instead of being located at a fixed site. So, now I want to talk about something which is of broader perspective. So, where will this be implemented? So, already there are avenues by which it is possible that by remote technology or by using the internet of things combined with telemedicine and other remote technologies, it is possible that even though most of the sophisticated doctors are not physically there in front of the patient, but the patient, some care is given to the patient through a computer based database system, where the interface between the patient and the technology is not a very sophisticated doctor, but trained rural women and remote doctors. So, this is the resource that you will have as human resources. So, the human resources are essentially some young girls who are trained to take care of the minimal requirements of interrogating the patient and putting that information in a database and making basic physical examination like maybe blood pressure, height, weight and all these things. The knowledge base is medical algorithm based software, and the technology that is supposed to be there associated with it is low cost communication, which is a part of the communication technology and diagnostics. So, based on this, there is a concept called as health kiosk, which one of our collaborators, I will acknowledge all the collaborators who have effectively contributed to our research here in this domain. So, essentially they have set up some small health kiosks. So, these health kiosks are basically small centers where the service is primary and community care. The objective is to promote public health and education and also develop a business model for tests, medicines and others. So, question is, how does this work? The patient approaches a clinic which is approximately 150 square feet shared in a local property which is centrally located in the village. The health assistant records demographic data, takes history and undertakes a limited physical examination in a tablet. Then documentation takes place in a pre-formatted template which is shared with the back-end doctor using internet. Then the doctor is connected over phone, talks to the patient and advises the health assistant on further requirement of clinical exam or tests. Eventually the doctor completes the prescription with medication and other advice, enters signature and shares with health assistant in real time. The health assistant from the computer takes a printout of the prescription, explains to the patient and fixes a follow up appointment. This is not free of cost or driven by charity. The patient pays for all services including medicines if purchased from the center, and then there is exit interview of the patient taken by a different health assistant. So, now an obvious question will come to your mind that what is the cost that the patient has to pay for this. So, because of the limited infrastructure that is used and large number of patients attending a kiosk, maybe only a few rupees the patient has to pay as a part of the consultation fee, and of course, the price of medicine as per actuals. However, the bottleneck is the cost of diagnostics. So, for example, even if the patient is paying rupees 10 for a medical consultation, which may be affordable, but if the patient now has to do a set of medical tests worth thousands of rupees, it may not be easily affordable. So, the real bottleneck of implementing this kind of technology or implementing this kind of a concept in a paradigm where the essential feature is low cost, the entire technological bottleneck is making the diagnostic procedure of low cost. So, there is a need for alternative technology for diagnostics. So, a significant percent of patients are recommended diagnostic tests which have to be done at laboratories far away. So, this as per the current resource constraints is done in the rural healthcare kiosks. This leads to delay, higher costs and inaccuracies, and this is a very significant thing. The origin of this inaccuracy is that sometimes samples are carried long distances without standards of preservation, because sample preservation is a very important aspect of coming up with correct pathological results. So, if a blood sample is taken and it is transported to a distant place without being preserved properly, this can give rise to erroneous predictions. Not only that, if there is a delay in predicting the results, that can lead to higher costs, not just because of basic test price, multiple conveyance, refreshments for the day, but also loss of daily wages of the patient because of long waiting time. If these were available, this model could provide definitive treatment to over 90% of patients. So, point of care diagnostics in the rural setting is a very big challenge, and then one requires the paradigm shift. So, when we go for a paradigm shift, this is where technological intervention is important. For example, power. So, in the rural places the power supply is often erratic, often it is not available and often it is of poor quality. So, one can go for innovation for both battery and power operated systems. Environment, this is a big challenge. Most of the times the traditional pathological tests are done in very sophisticated air conditioned laboratories where the conditions are very carefully controlled, whereas in the rural settings we have heat, dust, humidity, all these things are important. So, the technology must be robust so that even in the presence of heat, dust, humidity, the results should be accurate. Reagents, in the scenario the refrigerators or air conditioners do not work, supply chain it does not exist, skill sets, trained technicians are not mostly available, blood draw, trained practitioners or trained experts for blood drawing are not available, and cost there is a lot of price sensitivity. So, the cost needs to be cheap. So, you can see that for transforming the pathological laboratory based tests to point of care tests, there are lots of technological challenges, and some of these challenges are techno economical or techno social. So, this is the paradigm of point of care diagnostics that we talk about. So, instead what we design is something like this. So, there is a handheld device. I will explain that what are these handheld device in the remaining part of this lecture and the subsequent lecture. So, look into this slide, consider the step 1 where from the fingertip one drop of blood is loaded on the device. Then what happens is that this one drop of blood is passed into a large number of channels if a large number of tests needs to be done, or maybe a small number of channels only if a few tests need to be done. So, what is essentially done? So, I will talk about one particular example which is called as colorimetric testing. So, in colorimetric testing what is done is, if there is a particular ailment or disease associated with a blood sample, that will be associated with a particular antigen or antibody. Then if now you can assess that blood sample against a complementary or a matching antibody or antigen, then because of antigen antibody reaction there will be a change in color of the blood sample. So, the complementary antibody or antigen corresponding to which the disease, particular disease is interrogated, may be embedded on the wall of a small handheld device, and that wall of the device may be itself the wall of a microfluidic channel, because the blood sample can be transported along different microfluidic channels to go to different reaction sites where different tests will be done. So, here in the step 2 in the diagram you will see that, for example, there are 3 different test sites. So, the blood sample can go to 3 different test sites and 3 different tests will be done. So, at these 3 different sites 3 different chemicals are there, and the blood by reaching these places it may change its color, and sometimes the color change is visible. That means you can understand by looking into the change in color about the signal, but in most of the cases we need a more quantitative information. So, that means that the image of the change in color that needs to be grabbed and processed. So, it is possible that one uses a camera like a smartphone camera, for example, to grab the image, and then image analysis can be done to give the result of the intensity of the pixels under investigation. Now, there is already a calibration of the color intensity of the pixel against the biomarker that is being investigated. For example, hemoglobin concentration or maybe glucose concentration, how much milligram per deciliter will correspond to what intensity of the pixel. So, once that against that calibration this result is assessed, from that calibration one can tell that what is the particular blood parameter of that particular sample for that particular test. So, I hope I could clarify that how these tests could be done. There are many advantages of such tests, that these are portable and thus on spot diagnostics is possible. These can be functional with limited resources, like just a capillary based blood drawing from the fingertip that needs to be done. Sometimes the device in which this blood is loaded, that device needs to have a good capillary action, so that by surface tension driven flow or by capillary action the blood gets transmitted from the source to the destination where the chemical is there with which the blood will react. There are very common diagnostic devices made using the microfluidic technology where such capillary driven action is possible. Easy handling is one of the important aspects. Mass fabrication is possible, these are inexpensive, these require involvement of minimal infrastructures, the tests are rapid and the patient can be easily monitored, and if necessary such tests can be automated. So, I will talk about one example in this particular lecture, that is pathology with paper and pencil. So, normally paper based diagnostics is considered to be one of the very important research breakthroughs in the modern era, and this paper based diagnostics was originally introduced by Professor Whitesides from the Harvard University, USA. Now, although paper based diagnostics is a very simple procedure, what essentially you have to do is you have to make microchannels on paper. You may argue that can we do diagnostics without making microchannels on paper, on a paper itself? Yes, you can do, but you can do only one test, because if you put a blood sample and if there is a chemical already embedded in the paper, because of the diffusive or weakening action, the blood sample will diffuse in all directions. So, it could be blood, it could be urine, like that, and in fact there are common paper based devices, paper based kits, although not microfluidic kits, but paper based kits available in the market. These have been available for a long time, like the pregnancy test kits, for example. Now, if you want to make multiple tests with instead of blood diffusing in all possible directions with a particular reaction site where your camera will focus and grab the image, then instead of allowing the blood to diffuse all along the paper. So, this paper, for example, could be a filter paper, nitrocellulose paper, these kinds of paper. So, what you can do is that you can make microchannels on the paper. So, to make microchannels on the paper, what you can do is you can use a very traditional technique like a photolithography, for example, to make microchannels on paper, which is a very common procedure for semiconductor industry. Similar kind of photolithography you can use, but one simple way to do it is to do a simple inkjet printing process. So, in the inkjet printing process, what you can do is that you apply a basic 2-step process. In a particular step, in the first step you print the microchannel design on the piece of paper on both sides, and in the second step you print this in the inkjet printer, and in the second step you heat this system on a hot plate. If you heat the system on the hot plate, the toner particles which have come from the printer will melt and they will block the pores across which you will have no flow, and you will have therefore only flow in that direction in which the toner particle is not deposited. Therefore, you will get a unidirectional flow, and just by using a simple printer and a paper microchannels can be created. So, this is a kind of innovation that we require in the context of the developing nation, but that is not all. How can we make these diagnostics faster? So, one possibility is that instead of using just a simple paper, we use an electric field on the paper to make sure that the blood sample by electrokinetic action, we have already studied electrokinetics in this course. So, by this time you already know what is electrokinetics. By electrokinetic action, there is rapid transport of the blood sample from the source to the destination. So, very quick diagnostics can be done. Now, depositing electrodes for creating electric field is itself a challenge. In our research group, we overcame this challenge by introducing a new technology for the first time, which we called as microfluidics with paper and pencil. So, what is this paper and pencil technology? It is such a simple technology that even school children can use this. So, what we essentially have done is that we have scratched or rather scribed the paper with a tip of the HB pencil. So, this black region is the pencil sketch or the HB pencil sketch. So, because of the graphite in the lead of the pencil, this pencil sketch region on the paper acts like electrode, and that makes it very convenient that if you now connect copper wire leads across these electrodes, an electrokinetic flow of the blood sample can take place. So, actually we make a massive innovation in this technology by implementing two things. One is ultra low cost fabrication of the paper channel by using an inkjet printer coupled with a hot plate to make micro channels just by using printer and printing those on a paper. And the second step is by pencil sketching electrodes, we combine the electrodes with the paper based micro channel to make a paper and pencil based microfluidic platform. So, this can be a low cost platform at its best, and the good thing is that research facilities which do not have advanced fabrication for microfluidics like advanced microfabrication labs, or research labs which do not have enough money for expensive experimentation or for expensive equipment, just by having a printer, paper and a few pencils, you can actually make this technology work. So, I believe this is a very important innovation, and when translated into commercial practice, this could lead to very important paradigm shifts in the diagnostic world. Let us stop here for the time being for this lecture. We will continue again on this topic in the next lecture. Thank you very much.